Hello everyone, and welcome back to our channel. Today we're delving into the fascinating world of stereochemistry by exploring the molecule epinephrine, also known as adrenaline.
This video is presented under the supervision of Dr. Mukhtar Al-Gharafi.
Epinephrine is a critical hormone and neurotransmitter involved in the body's fight-or-flight response. Understanding its stereochemistry is essential for grasping how it functions biologically and how it can be utilized in medicine. Before we dive into epinephrine itself, let's briefly discuss stereochemistry. Stereochemistry is the study of the spatial arrangement of atoms in molecules and how this arrangement affects their chemical behavior and interactions. Key concepts include chirality. A molecule is chiral if it cannot be superimposed on its mirror image. Enantiomers. These are pairs of molecules that are non-superimposable mirror images of each other. Chiral centers. Atoms within a molecule, usually carbon, that have 4 different substituents, leading to chirality. Epinephrine has the molecular formula C9H-warentine-NO3 and features several functional groups. Catechol group, a benzene ring with 2 hydroxyl groups at positions 3 and 4. Amine group, NH2, attached to the side chain. Beta hydroxyl group, OH, also on the side chain. Importantly, epinephrine has 2 chiral centers at 1. Carbon 1, C1, the carbon attached to the beta hydroxyl group. 2, carbon 2, C2, the carbon attached to the amine group. These chiral centers allow for the existence of multiple stereoisomers. With 2 chiral centers, epinephrine can exist in 4 stereoisomeric forms. 1, RR, epinephrine. 2, SR, epinephrine. 3, RS, epinephrine. 4, SS, epinephrine. Each isomer has a unique 3-dimensional configuration, which can significantly influence its biological activity. The naturally occurring and biologically active form of epinephrine is the RR enantiomer. This specific configuration is crucial because DARI receptor binding, the RRR enantiomer, fits precisely into adrenergic receptors, triggering physiological responses. Enzymatic interactions. Enzymes involved in epinephrine synthesis and degradation are stereospecific. Epinephrine acts by binding to adrenergic receptors, alpha and beta receptors, on cell surfaces. The binding affinity and activity depend on the stereochemistry. RR, epinephrine, high affinity and full activation of receptors. Other isomers, reduced affinity and partial or no activation. This specificity is due to the 3-dimensional shape of the molecule, which must complement the receptor's binding site. In pharmaceutical manufacturing, producing the correct enantiomer is vital. Enantioselective synthesis techniques are used to preferentially produce the RR enantiomer. Chiral catalysts. These facilitate reactions that favor the formation of one enantiomer over others. Resolution methods. Separating enantiomers from a racemic mixture to isolate the desired isomer. Understanding epinephrine's stereochemistry has significant clinical consequences. Dosage efficiency. Using the active RR isomer allows for lower doses with maximum efficacy. Side effects. Minimizing the presence of inactive or less active isomers reduces potential side effects. Regulatory standards. Pharmaceutical guidelines often require enantiomeric purity to ensure safety and effectiveness. Several methods are employed to analyze and confirm the stereochemistry of epinephrine. Chiral high-performance liquid chromatography, HPLC, separates enantiomers based on their interaction with a chiral stationary phase. Nuclear magnetic resonance, NMR, spectroscopy provides detailed information about molecular structure and configuration. Optical rotation measurements determines the direction and degree to which a compound rotates plane polarized light. Pharmacodynamics. The RR enantiomer's specific interaction with receptors affects the onset, intensity, and duration of epinephrine's action. Pharmacokinetics. Stereochemistry influences absorption, distribution, metabolism, and excretion of the drug. Emergency medicine. Epinephrine is used in treating anaphylaxis, cardiac arrest, and asthma attacks. Drug development. Insights into stereochemistry guide the design of new adrenergic drugs with improved specificity and reduced side effects. Biotechnological advances. Recombinant DNA technology and enzymatic synthesis offer new ways to produce enantiomerically pure compounds. In conclusion, the stereochemistry of epinephrine is a fundamental aspect that determines its biological activity and therapeutic efficacy. The two chiral centers in epinephrine result in 4 possible stereoisomers, but only the RR enantiomer is biologically active in humans. Recognizing and applying this knowledge is crucial in pharmacology and medicine to develop effective and safe treatments. Thank you for watching, and I hope this video helped you grasp the fascinating stereochemistry behind epinephrine.